Reverend Vernon Shelton, who's from Long Island, tells us that for many in his congregation, the hesitancy to take the vaccine stems from what they're hearing and seeing online. So listen to this.
It's too fast. This vaccine, they came up with it too fast. There's not a lot of information about it. But unfortunately, I think a lot of people are listening to what they see on social media, what they see, listen to friends, rather than doing the necessary research. I had reservations, but I understand I had to weigh the risk of COVID versus the risk of the vaccine. And I decided that I'd rather take my chances with the vaccine rather than take my chances with COVID.
So how can we stop the spread of misinformation about the virus and the vaccines?
Very, very good question. I'm going to repeat 3 points that I have been saying all day. And I say all day because I'm having this conversation constantly in community. 1, healthcare systems, clinical research, the scientific community more broadly. We must demonstrate trustworthiness. We must have honest and open dialogue. And how do we do that? We do that by validating people's fears, validating people's concern, and validating their skepticism. When we're able to do that, when we're able to practice empathy and see the person across the table from us and understand their lived experience, that gives that person the freedom, that gives that person the permission to have bi-directional dialogue. So we need to hear from our patients. What are you hearing? What do you have questions about? We need to hear that from community. And once we hear that from community, we need to be able to, in very health literate and socially and culturally fluent terms, to begin to say what is fact versus what is fiction. And as we do that in healthcare, 1, acknowledging and honoring someone's humanity, and then 2, saying, let me have this bi-directional communication with you. This is fact and this is fiction. Folks are more likely to believe us. And 3, we must amplify the voices of Black and brown physicians, Black and brown public health professionals, trusted messengers in Black and brown communities who can carry this message and become assets to community to help people understand the science and to help people understand where can you go to for credible information and facts. That's the full court press that we have to do as a nation. And that's what's going to change folks along their decision journey. And that's what's going to save lives.